Coming up next from Detroit Public Television and the Detroit Regional Chamber, it's the top highlights of MPC20 Conversations, Respond and Rebuild, which we created in place of the traditional Mackinac Policy Conference. I'm Sandy Baru of the Detroit Regional Chamber. Just like we would have on Mackinac Island, we'll talk about the top issues facing Michigan, including COVID-19, justice and equity, and of course, the 2020 election. You'll hear from Governor Whitmer, Dr. Khaldun, the state's top medical expert, and other state and national leaders. Stay tuned, there's so much more ahead.
MPC20 Conversations is provided in partnership with DPTV and presented by Blue Cross Blue Shield of Michigan, with additional support from Accenture, Bank of America, Barton Mallow, Comerica Bank, Consumers Energy, Delta Dental, Dow, DTE Energy, Enbridge Energy, Ford Motor Company, Huntington Bank, ITC, KPMG, the Kresge Foundation, Kroger, Michigan Economic Development Corporation, PNC Bank, Ralph C. Wilson Jr. Foundation, Rocket Mortgage by Quicken Loans, the Skillman Foundation, TCF Bank, and by these supporters. Support for DPTV's coverage is provided by DTE Energy Foundation and Masco.
For 81 years, we've been here for Michigan. From day one to year 100, committed to the communities we call home, because we're here for it all and always will be. Confidence comes with every card.
Hello and welcome. On behalf of the Detroit Regional Chamber and Detroit Public Television, thank you for joining us for MPC20 Conversations, Respond and Rebuild. This year, because of the coronavirus, the Chamber was not able to host the annual Mackinac Policy Conference. But there's no doubt that now more than ever, our state needs serious and thoughtful conversations about where we are and where we are going. So we've partnered with Detroit Public Television on a series of digital events to provide the types of discussion you would normally expect at the Mackinac Policy Conference. Together with DPTV, we are pleased to bring our members and the community important voices on the critical topics facing Michigan today. You'll hear from leaders representing government, public health, and business regarding Michigan's response to COVID and our path forward. I hope you find these pieces of our COVID conversations as insightful as I did.
This year, we've had to confront challenges unlike anything we've ever seen. The COVID-19 pandemic has devastated families and sidelined workers and businesses. It's required that we completely change the way that we live and work. But throughout this crisis, Michiganders and businesses have stepped up to do their part to protect one another. Blue Cross Blue Shield, for example, announced with a number of other insurance companies that they would waive cost sharing for COVID-19 testing and cover the use of virtual care and telemedicine. Businesses across our state retooled their machinery so that they could produce hand sanitizer and face masks and more.
The city of Detroit has a lower case rate and percent positivity rate for COVID-19 than some of the outlying counties such as Oakland, Wayne, Macomb, or Monroe counties. And so that's why it's really, really important that businesses and hospitals and schools work closely with their local health departments so they can understand the spread of the disease and implement the appropriate measures to be able to slow the spread and contain it as much as possible. So I'll just say that, while 2020 has been an incredibly challenging year, we're all going to have to remain incredibly committed to fighting this disease. Even when a vaccine becomes available, and I certainly hope it will be so this winter, it's going to be some time before we have broad uptake of a vaccine and the immunity in the population is such that we can sufficiently spread the disease without implementing some of these aggressive measures that we've had to do this year. And this fall will be particularly concerning because we will have both flu and COVID-19 circulating. And we know that what that can do as far as people needing to stay out of work or school, or hopefully not, but it could potentially overwhelm our hospitals again, like we saw in the spring. And so I'm optimistic that we're going to persevere, but it's going to take some patience and dedication and commitment on all of our parts to be able to do so.
During the coronavirus crisis thus far, we have treated almost 5,000 patients in our hospitals, about 4,800 in our hospitals. Again, as I mentioned, at the peak, we had nearly 1,000 patients. Today, we're down to about 100 patients. And so you might say, well, geez, we're out of the woods and everything is just fine. I would tell you that, as you heard from our chief medical executive of the state, we're all very concerned about potential additional surge in the fall related to the flu vaccine. But more importantly, what healthcare leaders are very concerned about is the toll that the coronavirus has taken on staff. During this process, our nurses and our care teams and our physicians went above and beyond the call of duty day in and day out. You might ask, well, isn't that normal? It is from a care perspective. Our nurses and our doctors certainly put in 100% effort on a daily basis to ensure that our patients have safety. Unfortunately, during this pandemic, when it was really clear based on the governor's orders and based on medical science that hospitals should reduce to the bare minimum any additional traffic, any excess traffic in our facilities. What's not really known outside the walls of the hospitals is that our caregivers stepped in as surrogates, as family members. On many occasions, our caregivers were holding phones for an individual to say goodbye to a loved one because a loved one could not be with them as they were going through their last day or hours on this earth.
Historically, when Americans put their lives on the line to defend the rest of us from an enemy, we have shown our gratitude by providing them with educational opportunities to improve their lives. The frontline workers here in Michigan have been putting their lives on the line to protect us from a new enemy, COVID-19. This includes those working in our hospitals and nursing homes, grocery store workers ensuring we can put food on our table, child care workers providing care, working manufacturers who are making PPE, and those providing public safety or picking up trash or delivering supplies. They all deserve our thanks and our support. The Futures for Frontliners plan will help ensure these heroes have paths to opportunity once this crisis is over. It'll provide tuition-free college opportunities for people who've risked their lives fighting on the front lines of this pandemic. It'll help more workers acquire technical certificates, associate degrees, and at our community colleges, and potentially bachelor's degrees at our universities after this crisis is over. We're the first in the nation to do something like this, and I'm hopeful other governors and states will follow our lead to create more pathways to opportunity for people who have continued to stay on the front lines to protect our families.
During the past few months, starting with the George Floyd killing on the streets of Minneapolis, our nation has laid bare its wounds of racial disparities. As Eugene Robinson of the Washington Post, one of our MPC20 conversation guests, said, "This time, it's different." For more on this topic of racial justice and economic equity, we've compiled this collection of conversation segments from our many guests so far who have put this issue of racial justice at the top of their agenda. Join me in watching this compelling conversation.
It's quite frankly not a surprise that COVID-19 has impacted communities of color more than others. Again, when you talk about racism and policies like redlining, and the fact that our very orders that were put in place to protect people still had folks who were lower income and working in those services that were deemed essential when everyone else was able to stay home and work from home. There's just no question that we knew, there was no surprise that there would be these disparities.
I have to give a lot of credit to Dr. Joneigh Khaldun. She is our chief medical executive, African-American emergency room doc, who was looking at the early numbers and said, we've got a racial disparity here and we've got to educate the public on it. Michigan was one of the first 3 states in the nation to start sharing demographic data. And we worked to have an outreach specifically to communities of color because they have been disproportionately impacted by COVID-19. This disease has held up a mirror to the United States and reminded us of the very real health disparities that Black Americans face every day. So we created the task force on racial disparities, chaired by Garland Gilchrist, and on which Dr. Khaldun sat as well. The task force came up with a number of recommendations around outreach, around expansion of access to healthcare, around education and implicit bias training. But we also created the Black Leadership Advisory Council, which will work on an agenda that goes well beyond COVID-19. And I think that we should be proud as a state that we recognize a problem and we take action to solve it. Early on, we know that with 14% of our population being African American, 40% of the deaths were African American. Now that number is very close to being equitable, and those are strides that we've made because we recognize the problem. We worked to do outreach and to address it, and I'm proud of the work that we've done. But it's one step in a much longer journey.
What I would encourage us to consider is that racism is much more complex than what happens at an individual level, that we need to be thinking about the ways in which racism functions in our policies and systems and our cultural norms, and that these norms are historically grounded, and that they both simultaneously advantage and disadvantage groups of people within society and within our organizations. So thinking about racism as something that's structural and cultural in nature, and not something that's only a matter of exchanges between individuals.
About a year ago, in our hiring process, we would have 400 openings in some of our entry-level positions and have 1,000 applicants, but only 300 would qualify. And the majority of them would not represent a diverse population, particularly a very few number of Black people qualifying for the positions. And we really had to study our own receipts, as Dr. Khaldun said, and discovered we had this requirement, this one line in one job application that said should have experience operating heavy equipment. Now, who has experience operating heavy equipment? Well, I would suggest very few people from urban centers would have experience operating heavy equipment. I wouldn't have experience operating heavy equipment either, but it definitely biased unintentionally the selection process. And so it's investigations we've had to do like that to uncover unconscious bias in our processes, not bad people, bad process, not intentional, but needs to be addressed so that we can have equity.
So one of the things we have to do is really be cognizant of our biases and how do we parlay those into our day-to-day interactions and figure out how to peel that back. Let me give you, some examples of that, Sandy. When you think about today education, we allocate dollars to educate our kids based on the tax basis of the families who live in those areas. And so there's an implicit bias there for students who live in poor areas versus those who live in rich areas.
There is no neutral within your organization. Your organizations exist within, contribute to, and benefit from the socio-political landscape. There's no magical barrier that we cross when we enter our buildings, although very few of us are doing that these days. We are part of the very systems that are being called for consideration in the global political movement that's happening around Black Lives Matter. This is not only a matter of police violence. The systems that are being identified and held to account through these protests are education, health, housing, employment systems, etc. We are all a part of this problem, and we thus all need to accept responsibility and accountability in the work that we're trying to achieve, in the progress we're trying to achieve. So ultimately, what I would argue is that equity is not possible. Equity in any form is not possible without an anti-racist and anti-oppressive intention, analysis, and action. It has to exist at the outset of everything that we're doing. We have to anticipate how could I potentially be disadvantaging or advantaging groups of people, particularly on the basis of race, by the choice that I'm making with this policy decision? Or how do existing policies perpetuate advantage or disadvantage in ways that may not have been intended, but that is the pattern that we're observing nonetheless.
We've wanted to make sure now that all of our state employees, including us in the executive office, including the governor and myself, have gone through a pretty rigorous training on implicit bias as an understanding about how biases may creep in the decision-making process when we're not aware.
We always should be thinking about the intent should equal the impact. And one example of that has come out of COVID-19 is the disparities we're seeing with who has access to broadband. We're seeing kids that have access, and then we're seeing kids that don't have access. Well, the reality of their education will be very different because of those outcomes. So one of the challenges I think we as leaders have is to think about how do we want to ensure that in a capitalistic society, yes, we have to take care of the capital side, but we also have to take care of some of the fundamentals of the value side.
So I hope the distinction between thinking about anti-Black racism, even if you are a person of color, but you may be on the white end of the spectrum in terms of how you present, you are likely having a very different experience than someone who is in the same ethnic group, but who has darker skin. And that's important for us to consider, just as it's important for us to consider all of these different experiences around race and racism, depending on your race or ethnicity.
In her second year as Michigan's chief executive, Gretchen Whitmer was thrust into the national spotlight for her handling of the COVID crisis, dealing with a massive dam failure, and even being on the short list to be on a presidential ticket. Gretchen Whitmer is now a name known outside our state. During our discussion, the governor talked to us about her unprecedented tenure as Michigan's leader and her approach to addressing Michigan's dual public health and economic crises. The governor of Michigan, Gretchen Whitmer.
If you've studied pandemics, you know that there will be a second wave. The question is, how intense will it be? How long will it last for? We know the tools we need to keep ourselves safe and to keep a second wave from overwhelming us. It all comes down to what we do individually, what we do as a collective state. Will we continue to come together? And we're a lot stronger going into a second wave. We've learned a lot about this virus. We've built up our PPE stores. We've built up relationships with partnerships like Ford and FEMA around the donation of masks, Dow Chemical creating hand sanitizer. Our hospitals are in a stronger position going into it. If we get inoculated with a flu vaccine, that'll be fewer people in the hospital. That'll help us when we see a resurgence of COVID. But as the temperature starts to drop and we go inside, it's really important we all continue to keep our guard up, because that's how COVID spreads. When we're close in contact and we're inside, it's more dangerous inherently.
Again, it's all about knowing who has it and boxing the disease in, is what a lot of experts say. You do the contact tracing, make sure people are isolating if they're infectious, and that's how you will actually slow the spread of the disease.
No one wants to re-engage every sector of the economy more than me. This has been hard on all of us, and I know that businesses have made incredible sacrifice. I know that there are some businesses that may not reopen, that will struggle to make it if they do, and it's just I lose sleep over that, because I know that these are good, hardworking people who built something over the course of their lifetime. But this global pandemic is the reality that we are confronting, and I will say that Dr. Birx was in town here last week, and she was incredibly complimentary of how we as a state have stepped up and taken this challenge head on, and how responsible we have been in understanding the science and working with the business community to ensure that we've got policies that'll keep people safe when we do re-engage. I'm incredibly grateful for the work that the Economic Recovery Council did, the MERC. Jerry Anderson and Nancy Schlichting headed that up, but there were people from various sectors of business that helped inform a lot of the work that we have done. And I think because of it, we now know that even though we were one of the hardest hit states early on, we currently rank 40th in the 7-day average of new coronavirus cases per capita. And we're in the 40th percent in terms of positive tests and in coronavirus diagnostic tests. That's pretty amazing when you think that we're the 10th largest state in the nation.
So I'm proud to be a part of the governor's Michigan Economic Recovery Committee, which is a group that advises her regularly on those decisions. Obviously, the governor makes the decisions, but she's enlisted a host of business and healthcare and educational leaders to look at the data regularly that's provided to us by both the University of Michigan and some outside sources and the state to provide recommendations. And I would just say that this is a matter where there is no playbook. There's no guide that you can go back to and say, well, last time this happened, you did X. And so my sense is that Michigan has had, of the states that are hotspot states, when you look at the data around how we were able to contain the spread of new cases, particularly from the June timeframe onward. Michigan has outperformed the majority of states around the country.
We're in the midst of a global pandemic, and this is a virus that poses an incredible threat to our lives and our livelihoods. And so we took it seriously, and I issued a number of executive orders. The powers have been challenged in court. They've been upheld both at the district court and the Court of Appeals. We'll be going to the Supreme Court. We feel good that they will be likely upheld again. And yet, because of that, we now see an effort to take these powers away from the executive office. Now, I think it's really important to point out that these are authorities that we have conferred upon our chief executive in extraordinary circumstances to keep people safe. Each governor since 1945 has had these same powers, and I'm going to fight to make sure that every governor after me has these powers if, God forbid, they find themselves in a situation where they have to be used. The fact of the matter is we are in a stronger position than most other states in the nation because we got aggressive and took actions that were permitted under these 1945 powers. And so an effort to take those away jeopardizes all the work that we have done and also puts us in a much weaker position when we have a second wave, which we know, if you've studied a little bit about history and pandemics, knows that that's probably something that we're going to confront. And so declining to sign an effort to take these powers away is really important. This isn't about me. This is about making sure that we've got a governor who can take action to protect us when it's necessary. And I think that's really the crux of the issue. We've come a long ways. Let's not go back. Let's not jeopardize all the sacrifice that we've made. And let's make sure that a governor has authority to take action when it's necessary. We need a strong leader in these times, and we need to make sure that future leaders have these strong authorities.
So Governor Whitmer's strong orders, and quite frankly, I'll say the will and resolve of all Michiganders, hospital leaders, business leaders, we really were able to bring our cases down significantly. In March and April, we were seeing over 1,500 cases a day. And some days we announced over 150 deaths at our peak. In our hospitals and emergency departments, including Henry Ford, we have the CEO right last year here to talk about that today as well. They were particularly overwhelmed in Southeast Michigan. And together, we were able to bring that curve down.
In an ordinary moment, a global pandemic would take all of your energy, or a recession would take all of your energy, or a 500-year flooding event would take all your energy, or the righteous debate and conversation around racial relationships in our society would take all of your energy. And yet we've got to pay attention and work through all of these crises and continue to run state government and fix the damn roads, which we're doing, by the way. So there's no handbook for this moment, but there are sources of inspiration everywhere. And when I went to Midland right after the flood, and I saw people coming together, a community in the midst of a pandemic, evacuating people, and doing so with such optimism and sense of community. That was one of the most inspirational days I've had over these last 6 months. And there are sources everywhere. You have to seek to find them some days, but they are there. And it's the people of the state that make the state so great.
While we couldn't gather Michigan's top leaders on Mackinac Island this year, all of us at the Detroit Regional Chamber appreciate the chance to do the next best thing. Offer access to decision makers and experts to address the issues on all of our minds. I want to personally thank the 43 corporate and philanthropic organizations for their support in making these conversations possible this year. The Chamber also appreciates its long-term partnership with Detroit Public Television in delivering these conversations to the public. To see and hear these conversations in full, visit DetroitChamber.com and look for MPC20 Conversations. You can also view the upcoming lineup of discussions, which will continue through mid-November. Thank you for joining us. And until next time, we'll keep the conversation going.
MPC20 Conversations is provided in partnership with DPTV and presented by Blue Cross Blue Shield of Michigan, with additional support from Accenture, Bank of America, Barton Mallow, Comerica Bank, Consumers Energy, Delta Dental, Dow, DTE Energy, Enbridge Energy, Ford Motor Company, Huntington Bank, ITC, KPMG, the Kresge Foundation, Kroger, Michigan Economic Development Corporation, PNC Bank, Ralph C. Wilson Jr. Foundation, Rocket Mortgage by Quicken Loans, the Skillman Foundation, TCF Bank, and by these supporters. Support for DPTV's coverage is provided by DTE Energy Foundation and Masco.
For 81 years, we've been here for Michigan. From day one to year 100. Committed to the communities we call home, because we're here for it all and always will be. Confidence comes with every card.